It's pain in the back, right? It radiates to the jaw. You can actually feel it in the shoulder as well. Sharon felt this pain. Take a listen.
I felt this pain. It's like a bolting pain that went across my lower back. And the pain just radiated through my whole back. And it was hurting at an intensity level of a 10, definitely straight to a 10. And I couldn't understand what was going on. I got myself to urgent care. I'm glad that I did not ignore those back pains and just leave it as so, because once I arrived at the hospital and they checked me out, they told me I had a heart attack.
Wow. So what happened?
I woke up that morning and decided to get something to eat for dinner, and I went and was taking meat out of my deep freezer. And when I bent over and I stood up, I felt this pain that it hit me in my lower back, really hard. And it went down my leg and then went up to my back and my body. It felt like I was having back spasms. I've had back spasms before, so I identified it with that immediately. And then I called my chiropractor and I was telling him, and I had him on speakerphone and he was giving me some things to do. It just didn't work. And he said, you should hang up and call 911.
Smart move by that chiropractor. So you get to the hospital. You got this back pain, which a lot of viewers right now are thinking, geez, I have back pain too. But this is back pain in your upper back, to be clear.
Yes.
You show up in the ER, what do they do?
When I got to urgent care, they checked me out and EKG, and it said that the numbers were wrong and they needed to call 911. So I went from urgent care to the hospital. When I got to the hospital, they did an exam. I think they did an x-ray or whatever have you, and came back. It's like, you didn't have any back pains. And then a chiropractor came to visit me, who was my current cardiologist, came to visit me, and he told me, he said, so guess what? You've earned 5 days with us. And I said, 5 days for what? What are you talking about? I'm on the morphine, back pains, And he says, well, you had a heart attack. I said, I had a heart attack? Yes, I had he said, I had a heart attack. And once I got that information, I was completely blown away with the fact that back spasms and a heart attack, but I had to remove the back spasms out of my mind and understand that, and I was told that women, experience different pains.
Amen.
Before a heart attack.
You should send flowers to that urgent center. They saved your life. And send them to the chiropractor as well. So how are you doing today, and why did you want to come talk about this?
Today I'm doing great. Thank you. Thank you so much. And I've been inspired and encouraged by not only your show, but the American Heart Association, the Association of Black Cardiologists, the information that's given to us women about heart disease and what the different matters are about heart disease, that watching your show and finding out that you are a cardiologist and you do a lot of health talk, that encouraged me to start my own foundation. And it's called the Heart Speaks Foundation. And we speak to you about heart disease, and especially for women, because we overlook it. We go with everything else. I called my girlfriend and I was talking to her about the pain I was having.
Well, your heart's screaming to you, help me, because that's what the pain is, right? Your heart's saying, come and help me. Okay, thank you very much. I appreciate
Thank you so much.
When you think of pain associated with a heart attack, your brain usually goes to your chest, right? People think they're going to get like an elephant sit on their chest. Women are actually more likely to experience heart attack pain in the back, in the jaw, than men. So what you're saying is life-saving, because people can open their eyes and minds now to this possibility. Joining me now is my good friend, cardiologist, Dr. Mark Eisenberg. He's at Columbia with me, an ER doctor, Dr. Samson Davis, another good friend, just across the river in Newark. Dr. Eisenberg, back pain. Why does it happen there when you have a heart attack?
Okay, so it turns out when our bodies are being developed, the same nerves that supply the heart also supply the back, the jaw, the arm, the stomach. So it can be a little confusing to the brain. It's actually called referred pain.
It's like they short circuit. You've got wires that are touching that, you don't want them to touch, but they touch it, the way you're made.
Yeah.
And we're all made differently, so our wires cross in different ways. Dr. Davis, how common of a complaint is upper back pain with heart patients?
It's really not that common, actually. It's more atypical. Usually with true heart pain, we see the chest pressure in both men and women. It usually radiates to the shoulder or down the arms. But you can have atypical symptoms as the patient did with upper back pain or lower back pain. So you want to make sure, especially if you have risk factors.
So we've got to wake up to the realities that pain can come in many different ways. How would you treat a patient who came to you saying they had back pain and they're not sure what caused it, but you were suspecting it might be the heart?
Yeah, you start with history. So if they have risk factors, high blood pressure, diabetes. Then an EKG, which is electrocardiogram, we see if there's any activity that's abnormal in that EKG. So the history of EKG, blood work, we check a blood level called troponin, which is specific for the heart itself. So if there's heart damage, that troponin ideally would be elevated. Then there's the stress test, and obviously the golden sort of standard to make sure is catheterization. We see if there's any blockage in the vessel.
So it's not a mystery. It's that knowable reality. So if you're having chest pain, you don't have to suffer because you don't know whether it's a heart attack or not. It's relatively straightforward to figure it out. What are the telltale signs, Dr. Eisenberg, would accompany a heart attack?
Okay, so that's a great question. So in the majority of people, they do have chest symptoms, but usually there are other symptoms associated with it, like shortness of breath. You can feel dizzy. Sometimes you feel your heart fluttering. Sometimes nausea and vomiting. So definitely the chest pain, it could radiate to the back or to the arm, to the neck.
So let me underline what my colleagues are saying. I want you to go through the signs of a heart attack in your own mind so you don't miss them. So chest discomfort, pain in the upper back, neck, or jaw can happen. Shortness of breath, the most important sign, because it means the blood's backing up in your lungs. You got to get to that in timely fashion. And you can also get lightheadedness and nausea, and you break out in cold sweat. And you might be thinking, well, other problems can cause those symptoms as well. Well, you're right. Do you know how to tell the difference between chest pain from a heart attack and chest pain from an anxiety attack? Because they can look the same. I'll reveal what you need to know. That's next.